And I want to talk about something very important here that's impacting a lot of people. New data shows young adults, particularly Gen X and millennials, are getting cancer more often. It's a group of people also more likely to be starting a family. Oncofertility is a medical field bridging the gap between oncology and fertility, which is very interesting, so that more cancer patients and survivors can still start a family. And joining me now this morning, we've got Deborah here, Ikhena-Abel. She is a reproductive endocrinologist and fertility specialist at Aspire Fertility Austin. And it's been nice just even chatting with you here the last couple minutes. Thank you for being here.
Yeah, thank you for having me.
And you know, this is a really interesting tie. I've definitely even seen firsthand of more young people who are dealing with this, and it's kind of frightening. It's a little stressful, but bringing in the fertility aspect, what have you been seeing firsthand with this going on?
Yeah, there definitely has been an increase in the incidence of cancer over time. There's some recent data show that women who were born in 1985 are about 70% times more likely to be diagnosed with breast cancer than women born in 1930. So we have definitely seen this increase. Now, luckily, we've had a lot of advances in the treatment for cancer. So a lot of people are surviving treatment and then want to continue to grow their families or begin to grow their families. And with Oncofertility, we now have options that are available to these patients to basically, not have to give up their dreams for future fertility because they've been diagnosed with cancer and undergone treatment for cancer.
What are some things that, young women should be on the lookout for? Because I think over time, we're not always told, get in and you need to check for these cancers and things like that. And yet you're seeing it younger. So what do we need to be looking out for?
Yeah, so specifically with breast cancer, we know October is Breast Cancer Awareness Month. 1 in 8 women will be diagnosed with breast cancer over the course of their lifetimes. And prior to age 40, the most important thing is just to get a familiarity with what is normal for you. And so having a sense of what is normal for you through the cycle, that way if anything changes, you're able to then reach out to your OBGYN and have additional evaluation done. And then of course, I would recommend starting at the age of 40 to consider getting regular mammograms as is recommended.
What I think is cool is, can you tell me why you kind of got into this line of work personally?
Yeah, for sure. So I, in medical school, knew I wanted to work with women, and I knew I wanted to go into OBGYN and was interested in learning more about the subspecialties within OBGYN. And, going into reproductive endocrinology, I was able to experience treatment for infertility, which I do have family members with infertility, so that was very personal for me.
Yeah.
And I also really enjoyed the science and the medicine in the fertility space. There are a lot of options that are being available to patients now which were not available even 30, 40, definitely for sure 50 years ago. And also a lot of the genetic conditions which can be addressed in our space that were interesting and unique to me.
That is the one silver lining, is how much the research is advancing and having conversations like this. And Doctor, we're so happy you were here today, and thank you so much for joining us.
Of course.